Hello, everyone. We are so happy to have you all here with us today. My name is Kinsley, and I am a candidate success manager at High Counselor. And I have Dr. Christian Wernz here with me today, and we have a lot of exciting things to share with you. I know that we just went live, so we're just going to give everyone a minute to get settled and tune in. While we do that, if you feel comfortable, why don't you drop in the chat where or comment section where you're joining us from? I think it's always fun to see the different locations and area codes and time zones that people are representing. So I'm located in Georgia, near the Savannah area. If there are any viewers from Georgia, hello. Christian, tell us where you're joining us from.
Hello, I'm joining you guys from Charlottesville, Virginia.
So make sure that you share with us in the comments where you're joining, just so we can see all those different areas and locations and represent.
Ellen, I'm Richmond, Virginia. I lived there before. Oh. India, wonderful. My wife's actually from India. Born and raised.
Houston, Texas. Okay, so Texas is representing too. A lot of really great areas.
Right, UK. So much more international than I anticipated. Wonderful.
See some California. So we've got West Coast, East Coast, all over the world. This is amazing. Thank you guys for tuning in today. So we will go ahead and get started so that we can make the very most of our time. Again, thank you all for joining in. So just to tell you a little bit about High Counselor, we are a career accelerator, and we help job seekers land their dream job through a 4-ish week training period that covers important topics and concepts that you need to not only land interviews, but crack them. So during this training period, you're going to be able to attend behavioral, HR, and technical sessions. We're going to optimize your LinkedIn profile and your resume. You're going to have some mock interview sessions and some one-on-one time with instructors. We also have sessions on networking, how to network, how to conduct informational interviews, salary negotiation, which is a super important topic, and really just trying to make sure that you feel confident and comfortable as you apply to jobs and then interview. We have automated email networking for our candidates, as well as an automated job application tool. And then we can also provide direct referrals to companies that are within our network. So lots of really great features that are available to you all. I do see someone in the comments asking about those projects that are offered through High Counselor. We do offer those real world projects. Absolutely think you should check those out on our LinkedIn. And so we do those live sessions for data science and software development job seekers. So yeah, just make sure you check out the live projects that are hosted through our LinkedIn. We are currently accepting candidates that are interested in the program that are seeking software engineering, data science, and sales related roles. And I know that was a very, very quick overview of High Counselor, but we do have info sessions that are hosted weekly on Tuesdays and Thursdays at 7 p.m. Eastern Time, which means that we have a session tonight. And so I'm going to drop the link to that info session at the end of the webinar today. And just so you know, our next cohort does begin on October 2nd. So you have a little bit of time to join one of those info sessions and learn more and get all of your questions answered. But the real reason why you all are here, I know, is to hear from our guest speaker today. And we are focusing on data science in healthcare. And again, so excited and thankful to have Dr. Christian Wernz with us. So he is a senior data scientist at UVA Health, the academic medical center for the University of Virginia in Charlottesville. Prior to this industry position, he worked for over a decade as a professor, first in industrial and systems engineering at Virginia Tech, and later in healthcare analytics at Virginia Commonwealth University. His research has been funded by the Agency for Healthcare Research and Quality, the National Science Foundation, and the Harvey L. Neiman Health Policy Institute, among others. He's published over 40 peer-reviewed papers in leading healthcare, engineering, and management journals. Dr. Wernz received his PhD in industrial engineering and operations research from the University of Massachusetts Amherst. He was born and raised in Germany, where he earned his bachelor's and master's degrees in business engineering from Karlsruhe Institute of Technology, with stints at McKinsey and BWM. 3 years ago, he left academia and joined industry to learn more about data science, get hands-on experience in today's data science tools, and pursue the career path of a data scientist. So you all are in for a real treat. We have such a special guest. Again, just cannot thank you enough. And with that, I am going to go ahead and turn it over to you.
All right. Thank you, Kinsley. Thank you so much for the kind introduction. And thank you, everyone, for joining from different geographic zones. And actually, the challenge these days is then time zones. So I appreciate that. It's 2 p.m. where I am, but I know it's the middle of the night in India, for example. So I really appreciate, or other place in Asia, Malaysia, I saw earlier, Pakistan. So welcome. So let me jump right in and get to a key point. And the key point I want to address is why healthcare. And I'm actually going to with the chat working, and I see your comments. Put in the chat. Actually, I wanted to hear from you. Why are you here? I mean, why are you here in terms of healthcare? What interests you about healthcare? Either are you in healthcare and have a reason why you're in it, or you have a hunch why you want to be in it. What's an aspect of it? So we have a nurse turned product manager who wants to get into data science. Very good. We actually, have that in our organization where we have people actually coming to data science with nursing backgrounds, with other diverse backgrounds. So absolutely. So somebody who's basically already in healthcare and now wants to kind of go into other areas. What are the answers, do we have from you for why healthcare? Why is healthcare interesting or relevant to you? You may not see the chat, I'm not sure, but I definitely see it. So career stability, and we're gonna get to that. Absolutely. I mean, if you think about it, recession hits, people are still sick, right? They still need to go to a doctor, and their data still needs to be analyzed. So not going to go away just because there are fluctuations in the economy, for example. Someone wants just to have another exploration, like they're in the early stages. Maybe they're thinking about, should I go into healthcare, automotive, or finance? Maybe what are the differences? I work with healthcare products for women, or someone already in the healthcare space, and so all of you have very diverse and different reasons, to be here. Career growth. And I want to make, and I'm going to now go into the full screen, so I won't see your chats anymore. And if you have questions, we definitely have time, at the end for questions. I know Kinsley is going to keep an eye on the chat if there's anything going on technically, or if an urgent question, but I may not see them until the end. So why healthcare? Let me answer that. And actually, as a good data scientist, I asked ChatGPT, and I asked ChatGPT, why should someone start a career as a data scientist? And it gave me these 10 answers, and so with an explanation. And I thought they were actually pretty good. And so I'll just go briefly through them, and then we'll dive more into some of these in more detail. High demand. Healthcare generates a lot of data. In the US, in the last 10, 20 years, we went through digitalization from paper charts to electronic. So nowadays, in most hospitals and even physician offices, everything is digital, meaning all this and massive amounts of data are being generated, and meaning someone has to look at them. And more is the awareness also coming to healthcare that there's value in this data that needs to be looked at, and an Excel spreadsheet with someone just sort of copy and pasting stuff, it's not going to do the trick. with a massive amount of data available. Impactful work. I mean, you're healing people, basically. You're helping to help heal people, meaning it's you're not working in finance. We're just making somebody rich or somebody poorer, but you're actually, helping people, indirectly and sometimes directly. Diverse opportunities. Healthcare, I work in a hospital. And so many of you might think of hospital, but actually healthcare is much more than this. It's hospitals, it's insurance companies, it's pharmaceutical companies, it's device manufacturers, it's startups. I mean, there's a variety of opportunities. And so even though we call it one industry, it's actually many sub-industries. Lots of innovation going on. I think healthcare is kind of slow when it comes to the, taking on of innovation, because it's a conservative, cautious industry for good reason, because if you mess up, someone dies. But at the same time, we always want to, make people healthier, and in the US in particular, need to do that in a more affordable way. Job security was mentioned earlier. Economy fluctuations, won't affect you as much as other industries. Pretty stable. Healthcare pays good salaries overall. You're not gonna, it's not Silicon Valley level salaries, maybe, but they're higher than I think in other industries. Interdisciplinary collaboration. That means you can work with physicians, with nurses, with other data scientists, and so you have a very diverse environment intellectually in who you interact with. If you like to explore of an impact on ethical considerations, where your data science solutions have implications on who gets treated, who gets prioritized, then and you have to make these calls. Sort of the under the hood AI, has street-wide, traffic-wide implications. Continuous learning that applies, I think, to data scientists in general, but especially in healthcare. And I'll get to more into that. And then global impact. A lot of what I'm going to discuss today has somewhat of a US-centric perspective. I hadn't realized how many people come from internationally, but I think 80% of that applies to anywhere in the world. And people's biometric data is the same anywhere, and that needs to be analyzed. Or any hospital has payments and people need to be treated. So what you learn in one country applies to another country, and that actually makes you also mobile internationally, especially with the data science skills. All right, so now comes a little analysis, a little deeper, and this is where it's a little bit U.S. centric here. U.S. healthcare industry is the #1 employer in the U.S. by number of people, and so healthcare is a huge industry. I think 17 or 18% of GDP, gross domestic product, in the U.S. go towards healthcare, which is way higher than in any other country. Meaning we have a lot of people, a lot of resources going to healthcare. And so this is, there's lots and lots of opportunities. And those opportunities are both plentiful and diverse. So here on the left side, you see some of the healthcare subsectors. There's things that you think of, providers, that's healthcare lingo for physicians and hospitals and nurses. So basically in this industry, it's the hospitals and the physician offices. Then you have payers, that's healthcare lingo for the insurance companies. Huge, right? Then you have health consulting, also pretty big. Medical devices, huge. Pharmaceuticals, obviously big. Health I&E stands for innovation and entrepreneurship. So there are things that are in the startup community, as well. Health finance, health tech. And if you look at this graph here on the right side, it looks at the forecasted profits by healthcare sector. And so it basically multiplies the number of companies times their profit. It's sort of an indication of how much money goes around in certain areas. So providers, meaning hospitals, physician offices, and so on, are the biggest one. Next one up is pharma industry. And then comes insurance companies. Then we have, others, here as well. So I thought I'd look at some of the healthcare's largest companies to give you an ideas. And so that's also a lesson on when you make slides, don't use fancy fonts. They sometimes don't translate. And so what you see here in yellow, so these are the top, I guess it only shows 14. There's a 15th one I wanted to talk to you about. There are the ones here in yellow are the drug manufacturers. This is by market capitalization. So these are publicly traded companies. So that's a huge, huge field. Next one up are the diagnostics. Here, your medical devices, they're all very expensive, but also high precision and right, you're doing heart surgery. You don't want to get a cheap, knife, so to speak, and mess up the surgery. You're getting the best knife you can get, right? So not surprisingly, all these instruments are, very, very expensive. And then you see in dark blue here at the top and further down below are the payers. This is United. And if you're not into healthcare, you may have never heard of them. If you're in healthcare, you will have heard of them. There's United, there's Anthem, right on the list. Then comes Aetna, which is now with CVS. CVS, the drugstore, they merged or bought Aetna, so they're working together. And then Cigna is also on that list. And then one more in our top 20 that you don't fully see here is we haven't seen any providers yet. There's one on the list, and that's HCA, the Hospital Corporation of America, which is the largest for-profit hospital group. But that's it. Then generally you don't see hospitals, but there are over 6,000 hospitals in the U.S. 6,000 hospitals. I mean, that's a lot. Depending on how you count, between 5,000 and 7,000, meaning the really big ones, 5,000, and then another 2,000 are depending, psychiatry, children's hospitals, depending on how you count hospitals, that go into that as well. So 5,000 to 7,000, 6,000 is a pretty good number to remember. There's 6,000 hospitals in the US. And then we have HCA, the largest health system, meaning they have 182 hospitals. They're for profit. They're Nashville, Tennessee. And they run this, as a business. And if you're an American and have been to a hospital, there's a good chance you actually have been to one without you knowing. They don't put HCA as a brand name on it. It's called, Montgomery Regional Hospital or called something else. Then you have the Veterans Health Administration, or the VA, which is the government. So the government for the veterans runs a hospital system with 170 hospitals. So here's a list, and even to Americans or someone in here, many of these names they're regional. We don't know them unless they happen to be in our town. Same applies for the largest hospital, just by itself. Hospital size is measured oftentimes in bed size, how many beds they have. So Jackson Memorial in Miami is the largest one. I didn't know that before I made the slide. And then you get some of the more famous hospital or hospital groups, which are like the Mayo Clinic and the Cleveland Clinic and others. But this is a long list, right? 6,000 hospitals. And I work in a hospital, and I want to now make a case why work in a hospital is particularly interesting for data scientists. One of the things is that 10 of the world's 25 best hospitals are in the US. Here highlighted in yellow. And so if you're a little bit into healthcare, you will recognize many of these names. You have Mayo Clinic, Cleveland Clinic, Mass General Hospital, which is actually the teaching hospital of Harvard, Johns Hopkins, UCLA, Stanford. So you see the university academic medical centers, coming up here. So meaning you have in the US, you have the opportunity to work in cutting edge institutions. And even if you go further down on the list, you will still be at a very good institution, meaning which, has then the, that's my heuristic for them also working on the cutting edge of data science. But great data science teams can be found in any place. I gave you all these names, but it's not, I feel like healthcare is not like tech where you have to work for Google or Apple or whoever, Tesla, to be among the creme de la creme. This can be excellence in healthcare can be found in the most diverse of places. And to make the point, these are the 7 finalists of the US government artificial intelligence outcome challenge, which is a challenge that ran from 2019 before COVID to after COVID. And these are the seven finalists. And you see here on the right, you have 3 hospitals. UVA Health, where I work, is one of them. And then here you have a consulting company, and then here you have a sort of a Mathematica. Other sort of companies, probably not that large. And actually, so these are the 7 finalists. And actually, when the competition started, over 300 companies submitted submissions. And then came stage 1, where the top 30 were, made it to the next round. Among the top 30, you have players like IBM, you have Booz Allen Hamilton, you have Accenture, meaning really big players. But I think it's interesting that you see for the next round, a mix of players making it to the next round and trumping some of the much better resourced and bigger companies. And I think one of the reasons why is that to do good data science work in healthcare, you need to know both healthcare and data science. If you just have a picture recognition, can someone can recognize dogs and, who writes the best algorithm? You don't have to know anything about dogs. But that does not apply to healthcare. If you just give someone data and they don't know, the difference between, this and this from medical or healthcare delivery perspective, the algorithms, they send them in the wrong direction. So that would be my guess why some of these seemingly bigger companies, didn't make it. By the way, the winner, if you're curious, was Closed Loop, and with second place to Geisinger, in case you're wondering. But this is why I bring this up, because for me, this is actually the moment I joined UVA Health. So I decided I want to basically learn about, leave academia, learn about data science. And the best way to learn about data science is by doing it. So in other words, I said, I want to be a grad student again, but with an adult salary. And that was my solution. And so I saw, UVA Health had an opening. So I did my research on them. And that was certainly something that certainly impressed me about them. The fact that, there seems to be a data science team that knows what they're doing. And I'm saying this because, in your job search, there's, you can look, in places you may have never thought to look for really excellent, teams. So now that I motivated you for why healthcare and told you a little bit about my story of, how I got to where I'm in, is how to get in. So next slide is the key slide. If I had to just give a 1-slide talk, my next slide would be it. So I have your attention now. How to get in? Well, we look for 3 things when hiring: coding, math, and business. Actually, this is my boss's formula. So I asked him again, and he explained that, to me, that this is his way of evaluating candidates. So when we get candidates, he looks at them in person. I mean, there's no algorithm looking through this or looking for keywords or anything. Every candidate gets holistically evaluated and scored in these 3 dimensions. Coding, pretty straightforward. It's like, what languages do you know? How much experience do you have? In coding. Some of them are sort of healthcare related. So in our industry, knowing SQL, where you can pull data from databases, is very important. That's what we use. And then you need to do something with the data, so R or Python or something like that. So that sort of gives you a pretty solid foundation. Then math. Math, I guess you see it through your CV. You would signal that through your background, what you've studied, how well you've done in these areas. And so it's math. So you can kind of do like the logic operations of being a data scientist. So you can read journal papers and be comfortable also exploring, machine learning and the not newer math, but as new things come up in AI world, especially, new math will be applied. Can you work yourself into that? And then the third is business. And business, 2 aspects. One is your business acumen, like your ability to navigate the business world, in particularly your understanding of healthcare. And the second is your sort of project management, time management kind of skills. And so those 2. So business, basically, the business of healthcare, and then the business of just, for like in any job you would have, like, the soft skills. And he also told me that there's never a candidate that does all 3 perfectly. People like that don't exist. So if you're like intimidated, like, oh, one of my areas here is not that strong, that is actually normal. So I think especially for new graduates, the business side, I mean, how can you know about healthcare unless you happen to study it? Unless you've taken an MBA, course, or healthcare masters or something like that, you just don't have that experience, and that's okay. You're going to hopefully then get scored highly in coding and math. Actually, for me coming in, I don't know what my boss scored me at, but if I had to score myself, I'm like, math is pretty good, or at least, I can signal it on my CV. It looks pretty good. A lot of papers, engineering, PhD, and so on. Business, I think also pretty good. I studied healthcare for, over a decade, and, run a lab. And coding was, I think was my weak spot on my application. And so there's, which I think for a lot of young data scientists would be not the case. And so, my programming languages back then were like Java and MATLAB and Mathematica and Maple, and this was what I put on my CV. That's all I did, and so ever since, it was my graduate students who've you've done these things. But I guess he gave me said, well, I guess he has the potential to learn it. And sure enough, once I got the job, even before I started, I got the book. I said, what should I learn? Okay, SQL, R, Python, and I dove into it and got up to speed. And that same applies to wherever your weakness is. If business, healthcare is your weakness, no problem. You can learn healthcare. You learn it project by project. You learn it by doing that. Math is probably the hardest one to kind of learn on your own. And maybe that's just going to remain your weakness, and so be it. Just make your other 2 stronger. So that was it. How to get in, right? A little bit of my perspective. Nobody's perfect. You have these 3 things. Shine on 2 of them, and try to lift yourself up on the 3rd one as you move along. And actually, in terms of like the interview process, my boss then really scores scores everyone on these 3 dimensions, and then has a conversation with them to kind of update that score. So there's no algorithms, no funny business. And actually, one of the reasons what I really liked about UVA Health is job posting was most data science jobs have like, oh, needs to know this SQL, needs to know Python, 5+ year of this and that and that and that. Theirs was just like, needs to be able to think, have understanding of a system, and that was it. And I mean, it was very nicely written, not like that, what I just said, but there was not a single mention of any tools. And I thought that's the place I want to be, because you can figure out tools. Tools change. They're just, tools for the moment. You need them, but you need to be able to think. So how to do well? Well, so let me get into the question of data science. Is it an individual sport or is it a team sport? Meaning, are you going to be like all by yourself, like a Swiss Army knife, and you can, get it all done? Or are you going to be one of the knives and you have other knives, to work on to get the job done? That certainly depends on your boss, on your company, on your environment. When I started, I got paired up with a experienced other senior data scientist that was, much more senior to me, definitely by experience. And so they showed me the ropes and show you, where to click and things like that. And then over time, I also realized that there are certain things like, let's say, pulling data with SQL out of the data warehouse is something that is really hard for everyone. It's very complicated because the data warehouse is just massive. So it's not just the mechanics of knowing SQL, it's knowing where to look, what fields to get, which fields not to get. There's a lot of tacit knowledge. And many of my junior colleagues learned that. And I didn't like it. I didn't want to learn it. And so it became that I had a colleague who loves doing that, and she doesn't like doing the other things. So we became a wonderful team. And then our boss added another person. So now we're like a 3-person team, and we have all our strengths and weaknesses, and we work together as a team. Over time, I learned a little bit more about SQL and the data warehouse. The other person probably learned a little bit more about my strength of data storytelling and how to make good graphs and how to structure it, and how to set up the data experiment in the first place. So I personally enjoy working as a team, but also I think I'm a very good boss who recognizes people who like to work by themselves. Those exist as well, and they can do that as well. So there's not one answer. It depends on your preferences, and hopefully in your organization, your preference abilities are recognized, and you're being put to proper use. To stay in this knife metaphor, what should you aim to become? A jack of all trades with knowing every programming language in the world, and you can do anything: software engineering, data analysis, storytelling. Or are you going to be that one specialist which knows this one machine learning technique, and that's all you do all day long? Well, the answer is I think be the Leatherman, be this multi-tool here in the middle. If you're not from the US, this is like the brand name of this device here, like as multi-tool, which has, you have a couple of knives, and then you have this unique specialization here, the pliers on top, that really make you different and stand out. And so for me, it became, and this is sort of evolution with, it became actually on the business side, the areas of value-based healthcare and population health, meaning understanding how we as a hospital can provide better quality care at lower cost in an environment where insurance companies want to pay less and less and less, and the government is constantly changing things. So we need to have a better understanding of how patients are doing. We have to be proactive in their treatment, and how we're going to do about that. So that information is important for me as a data scientist, so I can ask the right questions. The client comes to you with a question, but that question needs to be then further massaged to become a data science questions. And some clients even need even more help. Some clients are very good and they can tell you exactly what they want and you give it to them. For some, 80% of the time, you have to work as a consultant, with them. So again, I think, for me, the Leatherman, the multi-tool versatility with a unique area of specialization works the best. There are people who love to be jack of all trades, and we need those. And there's also people that are specialists, and we need those as well. I think specialists have the potential, if they have an in-demand skill, to demand an extremely high salary. The downside is if that skill goes out of fashion, your CV falls apart. That's the risk. But then you can find something new. So again, be the Leatherman. I think that applies to 80%, 70-80% of people would be that my advice. But it doesn't mean that everyone has to be that way. All right. So, and another success factor is keep on learning, right? Data science itself is a field where you have to constantly learn in any industry. On top of that, you will constantly and continue to learn about medicine and healthcare. A medical student learns somewhere between 15,000 and 30,000 new words or terms. And this, I did elaborate research on this, and this is the minimum and the maximum number. So 20,000 is a good, I think, conservative estimate. 20,000 new words in 4 years. So you learn a few of them. And not only do you have to learn those medical terms, you have to use the US healthcare terms. What is a charge? And what is things that normal looking words, it means different things in a context. And I've been doing this for healthcare for 15 years now, and I'm still learning. I mean, this is you can do a weekend seminar on how does car manufacturing work, and you understand 80% of it, or how does supply chain management work. It can be taught in a weekend. Healthcare is a different beast. And so you got to be okay with feeling stupid from time to time when you walk into a meeting and they throw all these acronyms and you have I should know this. I've been in this for 10 years, but I don't know what they're talking about. That just happens actually quite a lot. The third point, I made that earlier briefly. Medicine is risk averse and conservative when it comes to innovation because the stakes are high. And so as a data scientist, if you deliver a product that has the tiniest of flaws and they get hung up on this little flaw to just throw the whole thing out, and you do this twice or 3 times, they're never even going to trust your numbers ever again. So that is a key challenge. Meaning you need to develop a good relationship with your clients and always willing to work on the numbers. Sometimes you can't go with the fanciest of solutions. And you have to learn how people in medicine, how providers, how physicians think. They think differently than we as data scientists. Probabilistic thinking is not the same for them as it is for us. Just let's put it that way. All right. So how to keep rising? So let's say many of you I think are kind of new, looking to get their first job. And I told you now, once you have your first job, how to do well. And now just give you perspective of how to keep going. So you will probably start here in the bottom as a data scientist, junior, intermediate. At UVA Health, we only have intermediate. We don't have junior, meaning the majority of we have about 15 data scientists in our team. A majority have a PhD. Many have a master's. And so that's, I think, also a little bit, that might be a function of my boss just hiring that way as a preference. It might be different in different environments. But we have certainly had people, very, very good data scientists with a bachelor's degree and just years of experience. So that shouldn't stop things. Next level up is senior data scientist. That's what I am right now. And we didn't have a principal data scientist position. And now they're just opened up one and gonna, promote people into it, because they realized that, our senior data scientists were leaving, because, after 5, 6, 7 years, we were like, okay, what's next? And well, there's only one director of data science, my boss, and so for the organization realized they need to put in another step in there. And so then some organizations have the principal data scientist. Some have, among the bottom 3, a different combination of things. But these are your individual contributor roles. This is where the majority of your job is about doing stuff. Certainly as a principal data scientist, you get more project management and team leadership responsibilities as well. But then comes a jump into the manager arena, director of data science, so my boss. And then in our case, our organization above him, that's called administrator. And then comes already the C-suite, the chiefs. So in our case, it would be chief for data scientists. It would be chief of data and analytics, for example. Actually, UVA Health doesn't have that position. They have it organized a little bit differently. And so every organization is a little bit different here as well. But I think my point is that as a data scientist, you can rise with your data science skills and perspective into the C-suite in hospitals and other organizations as chief of data, chief of analytics, chief of data and analytics are becoming more and more common. All right. So advice for success is you climb the ranks, make your clients happy. That's the first step. You're in an internal service role. I have different clients, physicians, nurses, doesn't matter. Make them happy. They will rave about you with your boss in an email. That's how you get noticed, and that makes your boss shine. And that's kind of your second goal. A few weeks into my job, we were all asked to do our annual review. I just started working there, but writing our goals for the next year. And I didn't know how to write them. So I asked my boss if he could give me his goals, so I know how to look at it. And then I just basically more or less copied and pasted his goals down to my level. I just modified them, what it means to me, because if my goals are his goals, I'm helping him, and he makes him happy. Why? And that's why organizations are structured hierarchically. Is the goals, the visions, they trickle down that way. So why reinvent the wheel? Make your boss shine, make your clients happy. The third point, especially for the youngsters, among you youngsters in the sense of just starting your first job, go in person or at least hybrid. Avoid remote. Why? I think, and I'm saying this as someone who's working remotely mostly now, but there's so much you learn in your interactions with your colleague about how to work. There's so much you learn about the organization, small things, big things that are very, very difficult to do online. So if you have the opportunity, and I understand you may not, right? But if you go fully remote, there's a price to pay. Yes, it is convenient. I don't want to go back to in person. I'm mostly remote, but also I have 20 years of learned all that stuff, but you haven't. So go in person if you can. It would be my advice, especially in the beginning. If you want to be successful and climb the career ladder, being online is a hindrance or slows you down. Keep honing your technical skills, obviously, project by project. Same applies to keep learning about the business of healthcare, project by project. So you don't understand something, look it up. Google it, learn about it, see how that works. That's what I mean. Or it's a new software, and just learn it. Like my junior colleague, he didn't know Tableau. I knew a little bit about it. I said, I'll teach you for an hour just to get started. And now he's way better than I am. And that's exactly how it should be. He took that opportunity and ran with it. Demonstrate thought leadership. And so now, as you're going down the list, you're rising through the ranks here, going up. Thought leadership, meaning demonstrate through your project that you really know your stuff. Meaning this method, you really are an expert in that. And you also, help that if you go to, let's say, conferences representing your organization, you're representing your organization as a thought leader. If you're like a team leader, lift up your team members, both the peers and subordinates. I mean, before make your boss shine, now you need to make the people around you shine as well. They will appreciate that, and so share the recognition and help them climb. I mean, that's what ultimately leadership is all about. And you'll learn that as you keep advancing your management leadership skills. Take classes that your organization offers, or online opportunities. There are so many of that, and so demonstrate leadership, people leadership, getting projects done, dealing with challenges with difficult people. See that as a challenge. Don't get annoyed by them. Just see like, oh, how can I work with this difficult person in a good way, and see this as a learning opportunity. And then last but not least, develop a vision for your unit on your organization. So eventually, you're not going to sit on the bus. You're going to drive the bus. That's what it means. So that's your path. So in conclusion, so we have some time for Q&A. Healthcare is a great industry for data scientists with diverse opportunities, ample growth ahead. Growth in terms of the market, but growth also career growth in both ways. Keep building your 3 skill domains: coding, math, business. And I think in conclusion, I would say healthcare offers competitive pay. You're not going to get like Silicon Valley rich, but it's good pay, and your work has a positive societal impact. And I think, let's say like work in finance or something, you may make more money, but most people after a few years, hate themselves, at least if you believe all the movies you watch, right? So I think healthcare is that sweet spot of good pay and societal impact. All right, with that, I'll stop here and invite Q&A.
Well, that was amazing. First, I thank you again. I know that I honestly, I just cannot thank you enough. I think that was so valuable to everyone watching. And I have no doubt that they also appreciate your insight. We do have a few questions. And Chris, I don't know if you can pull up those comments.
I can see them. Yeah, I can see them.
Perfect. Yeah. So we do have some questions coming in. A few people wanting to know if studying medicine or having a medical background is necessary to work as a data scientist in healthcare.
No, that is not necessary. Absolutely not. I think, as I said, earlier, with these 3 skills, let's say you're good in coding and good in math and interested in healthcare, you can come in and you'll learn that piece. So it's advantageous, of course, but not required. Actually, if I look at my colleagues, we have PhDs from physics that never touched healthcare before. I assume neuroscience. Psychology. Anything and everything. So not at all. I think having healthcare experience helped me getting in, not knowing coding so well, so that it can compensate for it, but it's not a requirement.
Right. Let's see here. Okay, so we've got a question from Anandita, and she is asking how many years of healthcare domain experience would be required to apply for a PhD in computer science with expertise in NLP and data science. So, big question there.
I think, Anita, I don't fully know the answer to this question. It depends a little bit on the PhD program, but I would think 0 is fine, because you're going for a PhD program, and you if you're in computer science, you definitely need a math background to get in, and then so I don't think you need a massive amount of experience there to get into PhD programs. I think that's a different game. PhD programs look at different things for that.
We've got someone that's curious about the type of master degrees that you see that gives an applicant a competitive edge. So MBA,
Yep.
Engineering, statistics.
Absolutely. In the US, master degrees in data science are becoming more common. Actually, even PhDs are still rare. They're probably just a dozen or so. But they're becoming more and more. And I know UVA has a school of data science. So school meaning at the college level. And they just for next year is going to do their undergraduate after they've done, the master's for a few years. And they're going to do a PhD program, as well. So, and there are many other, great programs out there. So, I think a master's, let's say you have an undergraduate in something, but not data science, and you really want to go into data science and are in a position that you would enjoy spending another year or two in school. I think a master's degree in data science puts you in a very strong way. In terms of these 3 areas that I talked about earlier, think about this. What do you want to go to school for, and what do you want to just read in a book? Healthcare, you can learn in a book. You don't have to go to university for healthcare, like understanding healthcare. But for math, that's very hard to read in a book and learn by yourself. So take that, right? And assuming that's what you want to do, right? So the coding and the math, and I think these things are the harder stuff. Get that through college education, and the other stuff on the side. Definitely get it. Take a course while you're doing it on data science and healthcare. Definitely. That's a big plus. But you don't have to study healthcare science and to become a data scientist in healthcare.
To piggyback off your last comment, we have someone that is asking for any recommended courses or maybe any other additional resources that you may have to start learning about healthcare and data analysis.
Yeah, it's a good question. It's like such a vast field that it feels really hard to know where to start. I know there are some sort of commercial. I see I'm curious about this stuff, so I get a lot of ads on LinkedIn and in Facebook and about all these different courses, and it costs a little bit of money. That's an option. I know that there are very low cost or almost free options as well, and so for example, what did I do just to for my learning, right? So I'm old school. I actually got a book. So I bought a book on R in data for data science, and Python in data science, and SQL in data science. I wanted to have the book and then the screen. And then later I did a Coursera course on how to get started in Python, and doing that. And it was with my university, with UVA, they had it. It was free for me, and it was University of Michigan offered it. And I'm putting all these things out there. There's all these other providers there as well. So it's it would take an entire degree to get you all the pieces, I think. But I think is at this point, I don't think they have a data science and healthcare degree. I think you're the strongest if you're at the point where you have a bachelor's degree and you're ready to go to more schooling, get a data science degree from a reputable place, whether that's online or in person. Either way is fine. Whatever works, and then explore the the specializations there along the way, do projects, and I mean, for masters with a couple of like healthcare projects, that probably scores very high on our like 3-dimensional scale on the healthcare front.
A few of the comments, again, just kind of in relation to what we're already talking about, is that some healthcare facilities may ask for certification. So while a master's in data science may be, what someone is pursuing or what someone decides, are there any specific certifications that may enhance a candidate's application?
That's a good point. So I'm under the impression, or let's put it this way, I think healthcare is an industry that likes certifications. The reason is nurses get certified, physicians get certified. So certifications are like important to some people in that industry, maybe more so than in others. Having that said, I think it's, especially to get in or get started, I don't think that's a requirement. I mean, it's always really hard to tell. If CVs get, scrubbed by machines when you apply and they look for certain keywords you don't know, that could be a factor. As I told you earlier, we look at all candidates, in person. My boss does. But I'm getting certificates along the way now, for example. So my boss and their boss, actually, they come from the DoD, the Department of Defense, military kind of world, where there's also a lot of certification. And so I wanted to do a little bit more management. So he said, oh, why don't you do a PMP, a project management professional? That's like a certification. So that is sort of probably the sort of necessary to get promoted to the next level. And I mentioned earlier this really good data scientist that had it was a bachelor's degree, and he kind of like just got to the senior data scientist role. And I think he was advised to get a master's degree, and he got one in data science, even though he was already, and I think he graduated best of his class, and to get higher. So in healthcare, I think degrees matter. Just the fact that if our team, I mean, 3/4 of a PhD, and I don't think you need a PhD to do what we're doing, but I think it just is a cultural factor. But don't go blindly out and get certificates. I mean, it's right. I think don't waste your money on that unless it's like it specifically.
Right. We have someone asking that how, as a data scientist, you integrate AI.
Yeah, it's actually very, very, very good problem. So it's I thought before there's going to be like AI and machine learning everywhere all the time, and I realized that actually 80% of my job is just to get the right data in front of the people that ask for it. And that's surprisingly challenging at times. And it is because of like finding that data, combining it, filtering it down, and putting it there. And so in our team, we do some machine learning AI work, but I think we're in healthcare much slower there than in other industries. And the reason, again, is that cautiousness by physicians, and sometimes maybe just, I mean, with AIs, you're taking over their job, right? So there's a little bit of a, just skepticism, motivated skepticism about that. And so when we develop a machine learning solutions, they just have to be very, very rigorous and very good. So we don't just, get a beta version out. And so healthcare, at least in a hospital environment, you are not necessarily working on the latest and greatest cutting edge on machine learning, because again, it needs to be established, and then we can, let it out, and confront the patients.
Love that. Guys, we are kind of closing in on our time. I am going to save just a minute for for Christian to share some last minute thoughts, but just a few things that I want to share with you really quickly regarding Hi Counselor. So we're going to drop some links in the chat for you or in the comments. We're going to drop a feedback form. And so would love to just have your feedback on today's session, anything that you want to share with either of us about how today went. Also going to share the link for the info session. So if you'd like to sign up for that for later today, you certainly can. Also dropping the link to the upcoming batch application. So October 2nd is that next start date. And so if you're interested in applying, going to drop that link. We also have a job fair coming up and would love to see you there. So we're going to drop the registration link for that. And then finally, I know some of you asked about those real world live projects. So also going to share the link for that. The last thing I would encourage you to do is just follow us on social media, on Instagram at Hi Counselor 2022, and then as well on LinkedIn. It's just a great way to stay engaged with our content and to know what events are coming up. Christian, thank you again for joining us today and providing us with some insight into how to get into data science in healthcare. Any closing comments from you or any last minute questions that you want to answer?
Yeah, thank you, Kinsley. Thank you so much for putting this together, and you and Hi Counselor. It's been a wonderful experience for me, and thank you everyone for coming and your participation. And I just scanned some questions and I'm going to give very quick answers. Okay. Python or R, you can use whatever you're comfortable with. I looked at both and I went with Python in the end, and after learning some R. So we're not a shop where you're like have to do one or the other. I think I saw that, and so that was that. And so yeah, feel free to find me on LinkedIn, send me an email, send me a message. Happy to continue this conversation. Always love to see people through that way. And if you have other topics, this was my first work here with Kinsley and company, and maybe we'll do another session, another topic sometime.
I would love that. Absolutely. We had a great turnout today. Thank you guys for staying with us. Thank you for the comments and the questions. We love it and definitely want to have you back. So thank you again. Thank you to our viewers, and we will see you all next time.
All right. Thank you.